Hi guys, it's Katie and Caroline here with Bow and Button. Um,
Hello.
we just wanted to reach out to you and let you all know how much we care about you right now. We're really thinking of all of you, especially our expectant parents. And, everything is evolving. Healthcare, the way we're delivering healthcare to you is evolving. Seems like almost every day there's a new change with COVID-19. And so we just wanted to reach out and provide you with some updated information about what to expect when you come in to have your baby and what your stay is going to look like. A lot has changed, but a lot remains the same. And, we just want you to really enjoy this wonderful time giving birth to your baby and the intimate time with your partner and your baby in the hospital. I've been the last couple of weeks rounding in the nursery and seeing the new babies, and I have to say I'm certainly enjoying that time. It's been such a blessing to be there and get to share in those moments with new families. But several of the parents have said to me that during their labor process and their stay in the maternity unit, they almost forgot what was happening in the outside world. They were just so delighted with their baby and that time with their spouse. And so that made me smile thinking of that there's still all of these bright moments that we need to hold on to during this kind of scary time. So
For sure, a nice light in all this haze
yeah,
and madness. So that's really special.
yeah,
There are some things I think that WellSpan's trying to institute too to help care for you and your baby as much as possible. We're still encouraging people, if you can, to enroll in My WellSpan so that you can access your physician and some services directly. There's an app called Baby Scripts that obstetrics is using with their obstetrical patients to help provide direct access without them having to come into the office if it's reasonable. And then certainly WellSpan is doing video visits for prenatal, antenatal, and lactation services. And that's a nice service to offer so you can stay at home and still reach out to your provider.
yeah, for sure. Those are all
Yeah.
great. There is also some new guidance as far as pregnant women that are working outside of the home. So I know WellSpan is very strictly implementing this for all of their pregnant employees, but we would encourage everyone outside of WellSpan to follow these guidelines as well. So any pregnant patient, it's recommended that you stop work at least 14 days before your expected delivery. So for all normal pregnancies, WellSpan's encouraging women to stop working outside of the home at 37 weeks gestation. And that's, to keep you and baby safe. And like I wouldn't even go to the grocery store during that time after 37 weeks, just stay home. So,
Right.
yeah.
Katie, I was also thinking it might be a great idea for dad to try to quarantine himself for 2 weeks if possible, or take some paternity leave so that, he's healthy to come into the hospital as the birth partner.
That's a wonderful idea. Definitely. Yeah.
Yeah.
Great idea.
Cer- and certainly some of the visitation policies, have changed in order to keep everyone safe.
Mhm.
Also, obstetric patients can have one partner or birth support person accompany them. That
Mhm.
person should be over the age of 18 unless they're the father of the child. All patients, visitors, and staff are screened for illness when they're entering the building, and they'll be asked to wear masks when they're in the hospital. Um, Visitors or support persons who are suspected of having infection or have been screened positive for coronavirus infection, they will not be permitted to accompany the patient. In the nursery and neonatal intensive care unit, visitors will be limited to just parents or legal guardians. And again, it's just to keep everybody safe. Only one of the identified parents or guardians will be allowed in the NICU at a time. As much as possible, they're also trying to have people limit the belongings or bags that they bring into the hospital with them. And trying to remind people to bring their car seats, so they have everything and don't need to leave to go home to get that stuff. We sort of forget about that. And then any patient tested or being treated for coronavirus is recommended to not have a visitor if possible. And, I think, please know that this decision is definitely made out of an abundance of caution for the health and safety of all the moms and babies and other patients that receive care at the WellSpan facilities. I know that's a tough one, but definitely safety is the top priority. And just trying to consider the risk of the support person being exposed to, the positive patient that creates possibility of further spread within the patient care unit. So,
Definitely.
Yeah, and I think while they're there, I just think both Katie and I want everybody to know that everybody's there to help you. It's definitely, being in the nursery is safe, and the babies are safe, and, all the decisions that are being made with top priority to keeping the health and safety of, babies, moms, and partners.
Definitely, definitely. Yeah. And I would just stress that what you said, Caroline, and echo that you are safe when you're there. And, all of the staff is being screened as well before we enter the hospital. We're all wearing masks to protect you. I think everyone should just feel safe. And know that we're here to provide top-notch care for you. I think the maternity and labor hall nurses are just cream of the crop. They're an awesome group of gals, and the NICU nurses too. And we all understand that this is a tough time for everyone, so we're here for you. And don't be afraid, and enjoy this special time with your family. One thing I just wanted to briefly talk on is self-care and prevention. So just the basics for prevention, if you do have to go out, to the grocery store, staying 6 feet away from other people, doing curbside if you can pick up. There are a lot of local places that offer that now, which is wonderful. Regular hand washing, avoiding touching your face. Do wear a mask when you go out if you can, and staying home when you're sick, and avoiding close contact with people that are sick. The other big thing that I think is important for everyone, but especially our moms postpartum, is anxiety and depression, particularly postpartum anxiety and postpartum depression. This is a tough time in our world. And so I just want to stress, don't be afraid or concerned or hesitant to reach out to your OBGYN or your family practice doc if you're struggling. We're here for you, and we want you to be able to enjoy this time with your new baby as much as possible. So.
For sure. And if you find that you need to be connected immediately to any behavioral health resources, support, or services, you can access the link. It's www.wellspanphilhaven.org/get-help/access to care, and that will direct you to which support service you can get and what's available to you. There are some 24-hour crisis hotlines that you can use. We recognize there have been many changes in the recent weeks, and we want to thank you for your understanding, as well as for allowing us to care for you and your family during this challenging time.
Definitely. Thank you, everyone. If you have any specific questions about your upcoming delivery, or anything related to COVID-19, please direct message us and we'll get right back to you. Stay safe and healthy, everybody. Bye-bye.
Stay well. Bye-bye.